thiamine, B1, is depleted by stress, inflammation, and poor gut health. This can lead to a self-feeding cycle wherein a lack of B1 in the diet is compounded by SIBO or fungal overgrowth. And then these, as they deplete thiamine, actually alter motility and can further worsen problems in the gut. Berberine is an alkaloid. Think caffeine, nicotine. These are both plant alkaloids. In this case, from a variety of plants: barberry, golden seal, golden thread, Oregon grape. And the use of berberine does date back some 3,000 some odd years in traditional and ancient Chinese medicine. So a interesting backstory, but again, we want to see if the traditional uses for gut and for wound healing and for metabolism hold merit modern day when examined with science. Berberine will upregulate LDL receptors in the liver. This will help remove cholesterol from the blood. And simultaneously, kind of like a twofer here, you'll see a decrease in cholesterol absorption in the intestines. Looking at a 2023 meta-analysis summarizing 18 clinical trials across 1,700 individuals, they did find some pretty impressive benefits from berberine. A 18-point reduction in total cholesterol, a 18-point reduction in LDL cholesterol, a 13-point reduction in triglycerides, and an improvement by about 2.3 points in HDL cholesterol. Looking at a 2023 meta-analysis, they found that berberine reduced inflammatory markers like C-reactive protein, interleukin-6, and TNF-alpha. So as it pertains to blood sugar, it seems that we almost get this sort of 2-for-1 benefit again. Improvements in blood sugar, but also improvements in inflammation, which improve this proxy for blood sugar, hemoglobin A1C. So for both inflammation and for blood sugar, I think it's worth considering berberine yet again. There are animal studies showing improvements in leaky gut, in dysbiosis by improving populations of lactobacilli, improving motility, and decreasing gut sensitivity. But we want to see what the outcome data shows us. Now, thankfully, here we have a 2015 randomized control trial with patients who had IBS. So bloating, pain, discomfort, constipation, diarrhea, or both. And they did find improvements in diarrhea, abdominal pain, urgency, and via the gut-brain connection, improvements in anxiety and depression when using berberine. Another data point here I felt worthy of discussion was a 2022 meta-analysis finding that berberine reduced the risk of colorectal adenoma, aka polyps, by 31%. Now, because berberine is an antimicrobial, it might be the antimicrobial or sort of antibacterial action that we at least think berberine exerts. Let me just make a side comment that in SIBO, berberine is often used to treat SIBO. I'll come back to a study on this in a moment, but at least anecdotally, berberine is recognized to be an antimicrobial, an antibacterial agent. It can fight things like SIBO. So perhaps the reason why we see improvements in colorectal adenoma risk is due to that antimicrobial action. And by the way, if this has been helpful, please comment and subscribe. This really does help us reach more people who are trying to improve their health, so it is quite deeply appreciated. How to use berberine? Using a dose, again, summarizing from all these studies we just covered, anywhere between roughly 700 milligrams per day up through 2,500 milligrams per day. A capsule tends to be about 500 milligrams each. And regarding duration, the studies have shown safety and effectiveness for anywhere from 6 to 12 months. That's what's been studied. That's what's been documented. Might it be fine using it for longer? Perhaps, but we don't have any data to inform that comment yet. And regarding the form of berberine, berberine HCl has been criticized or commented to have poor bioavailability, but this might not be a bad thing if that means it's going to have a somewhat localized effect in the gut. It has not been demonstrated that you need a more bioavailable form, and pretty much every study that we discussed used The less bioavailable Berberine HCl. So I think you're just fine using a standard Berberine HCl due to the fact that all of these studies showed, or most of these studies showed, benefit with this form. Let's discuss the two best uses of castor oil, which is a anti-inflammatory, antioxidant, and antimicrobial fatty acid. Firstly, what is castor oil? Well, it's a vegetable oil made from the castor bean plant, and it's been used for thousands of years, going all the way back to ancient Egypt and ancient Greece. The monounsaturated fatty acid that seems to offer most of the medicinal benefit in castor oil is known as ricinoic acid, and the mechanisms here in part are anti-inflammatory, antioxidant, antimicrobial, so it can fight things like bacteria and fungus, and also laxation, or helping to aid movement of the bowels. So then this brings us to what I feel is the first of two uses for castor oil, the best uses. And this was surprising to me, but coming across a 2009 randomized control trial demonstrating benefit for joint pain. 100 subjects who had knee pain, specifically as osteoarthritis, were given castor oil as capsules compared to a non-steroidal anti-inflammatory drug. And they found both groups had improvements in their pain. There was slightly more pain reduction in the NSAID medication group. However, that group also had much higher rates of side effects, whereas there were no side effects reported in the castor oil group. Now, again, they took this castor oil as a capsule, 2 to 3 capsules per day. And some people have remarked, anecdotally at least, that rubbing oil on a painful joint may also help. So you can use castor oil for joint pain in this application. Probably the best to use it as capsules, given that's what this study did. But again, some people are noticing or reporting benefit, at least anecdotally, with rubbing castor oil on a painful joint. So then the second use case that I think is the best for castor oil would be for skin and for eye health. Most namely, a 2024 clinical trial for people who had dark circles under their eyes found that castor oil cream was effective. After 2 months of castor oil cream use, they documented improved dark circles below the eyes, reduced wrinkles, and reduced skin laxicity, or it made it more tight. This was a cream product applied twice per day. It's important to mention that because with an oil, it's going to have the tendency to run. So just be careful with applying castor oil on or around the eyelid or eye, because it can run. And this is where we'll link to a cream product that won't be quite as prone to sort of leaching and running. The second use within sort of skin and eye is dry eyes. 2 studies have found that castor oil drops improved dry eye symptoms with a specifically formulated eye drop product. Very important here, do not apply undiluted castor oil directly in the eye. In the research that has applied this, it's been a diluted solution. For eyelid inflammation, what's also known as blepharitis, castor oil has been demonstrated to be effective. Also, a 2021 randomized control trial found that a roll-on castor oil applied to the eyelid was effective. And the design of the study here was interesting in the sense that they treated one eye with the oil and they didn't treat the other eye. So they could compare the eyes to one another. And they documented a reduction in eyelid redness, dryness, and improved thickness. The eyelid naturally thins as you age, and it can make a less flattering appearance. So the castor oil helped with improvement of the thickness. And additionally, it led to eyelash growth and less crusting of the eyelid. Again, just want to echo, this was a roll-on castor oil product, so it was a little bit different of a form, not a pure oil that would have the tendency to run. So just be careful with that. Health benefits of black cumin and its bioactive thymoquinone cover almost every physiological system. Let's outline the systems that black cumin can benefit, juxtapose that with, do we have clinical trial evidence really substantiating this is something worth you considering supplementing with as it pertains to the following: infection, bacteria, viruses, fungus, parasites, thyroid health, joint pain, allergies and asthma. This is actually an antihistamine, sleep, and this pesky molecule called orexin that can interfere with sleep, but black cumin helps to modulate. Benefits for cognition, hormones, acne, cholesterol, and blood sugar. And we'll make sure to hit on safety, side effects, and then give you a protocol for use. And if it sounds like a list that's too good to be true, I kind of get that. I was impressed, I have to say, with the breadth of research on this medicinal spice. Now, as some background, it may not be a surprise given all of the benefit that we're seeing through contemporary research, that there's a fairly ancient use of this spice medicinally going back 3,000 plus years. You see at least discussions of its use going back to ancient Greece, ancient Egypt, and even in areas of Islam. So there's a long history of use. Doesn't mean that it's beneficial, and this is why we'll, of course, look through a modern lens of scientific scrutiny. But black cumin is derived from Nigella sativa plant with over 100 bioactive compounds that promote health. But again, it might be the thymoquinone that is the most beneficial. Regarding safety and side effects, pretty strong safety profile. Based on all the above data, there was really a very minimal or no signal of any sort of contraindication or significant negative side effects, other than in some people having some nausea and bloating, some skin irritation when applied topically, and some dizziness and headache, which I do wonder, given the antibacterial, antifungal nature, if some of this is just a byproduct of sort of a die-off reaction, if you will, of the antimicrobial action. And there are no really good long-term studies on black cumin seed oil. So this is why in the protocol that we'll come to here in a second, we're recommending a truncated use of roughly 3 months. And so let's close out our discussion with the protocol. So this is looking across this myriad of clinical trials. What are the dose ranges and forms used? You can use as a pill, as either a soft gel or a capsule, as an oral oil, but it does have a bitter taste, or topically. Now, if you're using it as a pill or a capsule, 500 milligrams up through 2,000 milligrams per day for 2 to 3 months. And the oral oil is 1 to 2 teaspoons per day for 2 to 3 months. And the topical cream, as directed, I would start with a small amount, make sure it's tolerated, and then you can sort of increase the area that you're applying it to, again, for 2 to 3 months. And then a few things to look for regarding manufacturing. You want to look for a high thymoquinone content. That's sort of, again, like the hero of this story. Cold pressed or C2 extracted usually leads to higher thymoquinone content. Organic, so that it has minimal fillers or additives. A dark color or a non-see-through bottle to protect from oxidative and sort of light stress, if you will. And then third-party testing for purity and for screening of contaminants. So in recap, I hope you now see where my interest in this compound comes from. It's a antimicrobial, helping to fight bacteria, viruses, fungus, and parasites, can improve thyroid function, assist with joint pain, help with allergy and asthma through being antihistamine, mast cell stabilizing, and T cell regulatory, can improve sleep through modulation of cortisol and orexin A, can improve cognition, can help balance hormones, namely estrogen, improve acne, lower cholesterol and blood sugar. Why this is so important is because we can't synthesize it. We're totally dependent upon dietary intake. Not only that, but thiamine, B1, is depleted by stress, inflammation, and poor gut health. This can lead to a self-feeding cycle wherein a lack of B1 in the diet is compounded by SIBO or fungal overgrowth. And then these, as they deplete thiamine, actually alter motility and can further worsen problems in the gut. And so it's probably no surprise that this is a somewhat common deficiency, but it also seems to be overlooked. And part of this is because testing is notoriously inaccurate. So health officials, if you will, are a little bit at a loss for how do we quantify this? But let's have the discussion today so that if there is a simple vitamin solution to some of the gastrointestinal and neurological symptoms that might be plaguing you, then we can point you in the right direction along with a protocol. A large body of evidence dating back decades suggests thiamine deficiency is neither rare nor limited to traditionally defined populations, but that it is simply under-recognized. As a little bit of context, vitamin B1 was actually the first vitamin ever discovered. It functions to allow the mitochondria, partially via the Krebs cycle, to make energy, so cellular energy production. It also has important functions for the immune system. Think innate immunity on the one hand, so this is the barrier of the gut, but then also adaptive or antibody production, B cells and T cells on the other. And in addition to all of this, it's crucially important for the nervous system because to make this chief neurotransmitter, acetylcholine, we need thiamine, vitamin B1. And this might be part of the reason why we see a number of symptoms, but they tend to consolidate to two systems we talk a lot about, the gut and the brain, or the brain and the second brain, as it's also called. Digestively, poor appetite, indigestion, heartburn, nausea, vomiting, abdominal pain, bloating, constipation, and food intolerances. Again, thinking that a lack of acetylcholine doesn't allow things to move through the GI tract at the appropriate pace. So this is where you get things like indigestion. But then also knowing that innate immunity and the barrier of the gut therein requires thiamine, we get the leaky gut and sort of inflammation of the intestinal tract. Now, coming up to the brain, the primary brain, neurological symptoms include fatigue, brain fog, irritability, mood swings, neuropathies or tingling, memory loss, and even disturbances in sleep. Another question we should think about is, are you depleting what you already have? Maybe you're not in that 56%. Maybe you're getting enough. That's not the complete story because there are things that can actually accelerate depletion even in what you are already consuming. This study from 2001 was very telling. What they did was have subjects consume progressively higher levels of carbohydrate in their diet. They found correspondingly for every interval increase of carbohydrate in the diet, a lowering of thiamine in either the urine or the plasma. In fact, this is kind of how thiamine or vitamin B1 deficiency was initially discovered in Japan when they started polishing or making the brown rice into white rice and removing the husks. The husks contained the majority of the thiamine. And this is where we first see beriberi and vitamin B1 deficiency pop up due to that population having a high consumption of carbs, but now doing so in more of a processed rice format, and rampant thiamine deficiency followed. Processed food is also another way in which you can deplete thiamine, as are the consumption of alcohol, coffee, and tea. Now, I'm not saying that you can't have any alcohol, coffee, or tea, but think about this. If your dietary carb intake is kind of high, that's pushing you toward deficiency. If you consume a lot of coffee, a lot of alcohol, right, all these things are pushing you further in that direction of thiamine deficiency. Now, I want to come to this other concept of secondary deficiency. This is what I think is probably more common in a cohort of people like us who care about their health, who probably tend to their diet, maybe use supplements, but they're proactive, right? So the likelihood of a overt dietary insufficiency is lower, but in the people who have some chronic symptoms, whether it be small intestinal bacterial overgrowth or chronic bloating or abdominal pain or suspected candida or an inflammatory condition of unknown diagnosis, this is where I think we run the highest risk of deficiency due to secondary deficiency. So it's deficiency of thiamine secondary to something that's taxing the body's ability to, or the body's stores of thiamine. Let's come to the protocol. And again, I want to credit and thank Elliot Overton for putting a lot of this together. I'm just sharing it with you. Again, a lot of this has been taken from him. There are three general forms of thiamine. Thiamine HCl, that's going to have the lowest bioavailability. Benfotiamine, which will have high bioavailability, and TTFD, which also has high bioavailability. Now, with Thiamine HCl, the dose that can be used is anywhere from 100 to 2,000 milligrams per day. With the benfotiamine, anywhere between 150 and 1,200 milligrams per day. And with the TTFD, because it's so bioavailable, 50 to 500 milligrams per day. And the general approach is to use a combination of these, but these are the target ranges for each individual. And really the one thing to be the most aware of is with the TTFD form, you shouldn't go much above 500 milligrams per day. And that leads to the phasing protocol, if you will, because we do want to sort of work our way onto thiamine gradually. Week 1, your total dose across these 3 different forms of thiamine of B1 would be 400 milligrams per day. Then week 2 to 3, you can escalate to anywhere between 600 and 1,200 milligrams per day. And then the final leg here, weeks 4 to 8, 1,600 to 2,000 milligrams per day. Thiamine is very safe. However, it's been somewhat well identified what's known as a paradoxical reaction, where when going on to a higher dose, a repletion protocol, people can have a temporary worsening of their symptoms. Now, this is not die-off, because die-off occurs when we use some sort of killing agent, correctly labeled a paradoxical response, wherein people may notice they're more tired or their digestion seems to get a little bit worse. This is important to bear in mind because this actually might be a good sign that you need the thiamine and the thiamine is working. According to Overton, it tends to occur in those who are more severely deficient. In fact, we did have someone, this is another one of Dr. Scott's cases, who noticed every time she increased her dose, I think it was her constipation, if I'm recalling correctly, got worse for a few days. Then it got better. And then a week or so later, when she upped her dose again, the same cycle repeated itself. So just keep that in mind and go low and slow. It's not a race. And this is where I think the gradual increasing of the dose is going to be better and more advisable than trying to go right to the high dose. This negative symptom flaring, this paradoxical response, may last anywhere from a few days to a few weeks. If it's a few weeks, that's probably a good sign that you want to back off the dose. So I would give it a few days, and if after 2, 3, 4 days you're not seeing the symptoms abate, that may tell you that the dose is just too aggressive, so back it off slightly. And then what do you do if you don't respond? Well, if you've worked your way up to 2,000 milligrams per day, and you've done this for about 4 weeks and you have not seen improvements, then thiamine deficiency is probably not the problem. And there are some other things to consider: SIBO, candida, a vector-borne infection, mold, hypothyroidism, B12 deficiency, and potentially mitochondrial dysfunction. In case you haven't heard of curcumin, this is a polyphenol, a compound from plants that gives, in this case, a very orange color. Turmeric is sort of the less isolated form, and curcumin is what's used in many supplements. Curcumin also has a long history of use in Ayurvedic medicine. But let's juxtapose sort of the traditional Ayurvedic use with randomized, current controlled trials. So firstly, regarding the diversity of the microbiota, you've likely heard that there is a general trend that people who are healthier have a richer microbiota, more species, more plants in the garden, so to speak, and those who are less healthy have a less diverse microbiota. One of the things that can dictate the health of the microbiota is inflammation. In fact, this is one of the pieces that I feel is often incorrectly portrayed to the public. The misportrayal is eat lots of fiber and prebiotics, feed your gut bacteria, therefore have a healthier microbiota and more diversity. And that's not untrue, but who it disserves might be people listening to or watching this video, those who notice they have sensitive digestion, might be flared by directly trying to feed those bacteria. But there's another way in which we can optimize the health of the world of bacteria, and that is through reducing inflammation, because inflammation is actually, for lack of a better term, poisonous to the microbiota. Inflammation makes it harder for healthy bacteria to live and favors unhealthy bacterial growth. This is likely why at least one randomized control trial that administered curcumin for 2 months found a 69% increase in bacterial species just from using curcumin alone. Again, likely due to the anti-inflammatory effects, less inflammation, healthier environment, and then healthier bacteria and fungus then grow. I should also just quickly mention that there are meta-analyses finding improvements in inflammatory bowel disease, in inflammatory markers, in joint pain, either in RA, rheumatoid arthritis, or osteoarthritis, and also small improvements on metabolic health like body weight, blood sugar, and cholesterol. Again, all likely due to that upstream modulation of NF-kappa B. So then how to take curcumin regarding dose and form. I feel, and this is just essentially what you're seeing used across most of the trials, a dose of 500 milligrams per day up to 1,500 milligrams per day. Most curcumin is anywhere between 250 and 500 milligrams per capsule. So this looks like 1 to 2 capsules, maybe 1 to 3 times per day. You can use a higher dose. Some trials have actually used 12 grams, that's a very high dose, safely. Regarding term of use, long term, studies have monitored people for up to 12 months and found safety. So I think it's safe to conclude this can be used long term. Now, to the question of, is higher better? And there are some cases where we want to be aggressive with our dosing. Certain applications of antimicrobial therapy fit this profile. However, this is not all situations, and curcumin is one of these, wherein higher dosing does not mean better. There have been numerous meta-analyses that have looked at sort of a dose response, if you will. Do we see a trend line that higher dosing equals better response? And the answer is no. Looking at inflammatory cytokines, inflammatory bowel disease, blood pressure, liver function, and lipids, these meta-analyses have not found a dose response, meaning the higher you go, the better the result is. Hence, 500 milligrams up to 1,500 milligrams is probably going to be the best dosing for most people. Then we come to the form. And this harkens to something known as the curcumin paradox, which is curcumin is not very highly absorbed. However, we still see a number of benefits despite the moderate level of absorption. I feel that what is known as the second generation forms of curcumin strike the best balance between research studies and effectiveness. What about methylene blue? This is something that I recently did some experimentation with, and it's purported to be an antibiofilm. I'm assuming there's probably some in vitro data, at least mechanistically. I have to say, cognitively, for me, I felt fantastic on methylene blue. And I know it's also purported to help with mitochondrial function, and so that may not be surprising. You're using methylene blue orally, IV, both, and I'm assuming you're hitting a pretty decent dose for the antibiofilm. I know Marty Ross recommends 50 milligrams up to 2 times per day.
Sometimes
What are
more.
you doing? What are you noticing?
Because it has, the studies show that it has Bartonella activity, anti-Bartonella, particularly the stationary phase of Bartonella. So it's a tool for killing, like you said, biofilm for mitochondria. You probably used, do you recall what your dosing, did you use like 5, 10, 15 milligrams?
I had tablets that were 15 per tablet. I started with a Troscript, actually, if you can see. And my tongue is blue. So the Troscript, shout out to Dr. Scott Scher, who gave me some samples. I think this is more so for if you're trying to get a little bit of a cognitive buzz, but you can't really go high when you're using the absorption through the tongue. You can get maybe 16 milligrams. But it's inconvenient, right? Having the blue
Yeah.
tongue is a little bit weird. So I used pills that were 15 milligrams and two of
Okay.
those a pop
Oh,
twice
okay.
per day. And yeah, I felt a nice benefit from them. I noticed when bedtime came, I was energetic all day. And then at 10:30, 11, I was just ready to go to bed. So I had a nice
Nice.
response to methylene blue.
Oh.
Although after about a week, I started getting some joint pain. And
Oh.
this hints at something that I'll just briefly touch on, which is I think I was over supplementing in trying to improve my health. I think I've had a little bit of an issue with Bartonella over maybe the past year. How this transpired was lots of
Mhm.
stress. And then I think I needed some antiviral and anti-Bartonella support. And I probably got over that pretty
Mhm.
quickly, given a quick response. But I said, well, let me do everything I can to get myself as healthy as possible. And I didn't stop using the supplements. I think I overtreated and I started reacting to things. And I think it's because I taxed my
Mhm.
liver. So one of the things I've seen is response. And then I start having signs of liver toxicity, redness in the eyes, joint pain, at least as I've been able to tell. So a quick lesson, I don't
Oh.
want to take the floor too much away from you, Tanya, but there is such a
Oh.
thing as oversupplementation. And as much as I've said this on the podcast, I've also learned it myself, which is why in the clinic we try to be good about not just giving people handfuls of supplements. So methylene blue, good for a while, but I think and as I'm doing now, need to chill out with the stuff that I'm taking and be careful not to
And
overtreat.
I wonder, just to give you another perspective, if I may,
Please,
I wonder in some
please.
ways if you were actually opening up your biofilms. I mean, this is the biggest issue I think with infection, and I should have mentioned it even earlier, is that really like all these infections live in biofilms, and there's probably other infections and other things that are living in biofilms that we can't handle. So I think if you were breaking stuff down, or maybe even killing a little bit with the methylene blue, because the dosage you were getting to, right? If you were doing like 30 milligrams, 215s twice a day, so you were getting up to 60 milligrams, that's already the antimicrobial dosing, not just mitochondrial dosing. And I
Right.
wonder if you were two things, either stirring the pot and making things a little bit more like you're starting to kill, and then they were getting more activated. That's kind of one of the things that we see a lot, or whether you started breaking down biofilms and you couldn't handle what was being released from the biofilms. So as you pull back on that stuff, you'll feel a little bit better. Things will calm down. And that may be why, right? So that's just my perspective, and I don't doubt the liver was being taxed too. I'm sure there was a combination of things, but I wonder,
Right.
and that's the challenge of using things like methylene blue. I'll do a much lower dosage if I want the cognitive stuff for patients. But as I start to go up in dosage, I have to make them aware that we're actually killing, and so I have to make sure that I'm also supporting them in other ways with the methylene blue. So, generally, I might start somebody out again like 5 milligrams or 10 milligrams for cognitive stuff. I might get them up to 15 milligrams, maybe once a day, if it's again cognitive. But then, yeah, 25 twice a day, 50 twice a day. I've gone higher than that for patients that we've done this dapsone protocol, which is a protocol that Dr. Horowitz put together and published on. So a few patients that I've done the new dapsone protocol in, we're up to like 300 milligrams of methylene blue twice a day,
Wow.
which is a little. It's only a few days, but it's up there. But generally, if I'm going to
Right.
use it not in that protocol, and I'm going to use it in a protocol where I'm using herbs, I'm going to make sure I want people on clove, oregano, cinnamon, maybe peppermint, because that's going to help support the biofilms, but it also has activity against stationary phase Bartonella. I'm going to combine it again with the methylene blue. Then I'm going to do, I might do other things to help support. Because what I've learned actually is that methylene blue, if you go too high alone, you are maybe starting to kill and the body's not ready for it.
Let's break down Huperzine A, or Huperzia serrata is the name of this moss. So it's a compound naturally derived from a moss, actually discovered by the Weizmann Institute in Israel in the late 90s. And what was so interesting about how this was discovered is at the Weizmann Institute, they were doing 3D modeling of the acetylcholinesterase enzyme. This is the enzyme that breaks down acetylcholine. And when doing the modeling, they discovered a notch in this enzyme, acetylcholinesterase, that Huperzine A docked into, and by doing so, reduced or inhibited the breakdown of acetylcholine, therefore allowing acetylcholine to build up in the brain. And I'll weave in, of course, why that's important in a second. But let me start with this quote by Joel Sussman. It is as if this natural substance were ingeniously designed to fit into the exact spot in acetylcholinesterase where it will do the most good. Now, acetylcholine ties into memory in part, not limited to, but in part because the hippocampus is very dense with acetylcholine receptors. And the hippocampus is really where we convert short-term to long-term memory. And you'll see, as an example, and also where some of the research has been done in Alzheimer's, literally a shrinkage of the hippocampus and just the brain in general, which is where and what underlies some of the memory and kind of impairments that occur in Alzheimer's. So, as you can probably imagine, if you inhibit acetylcholinesterase, you have a buildup of acetylcholine, you have better neurotransmission, and this can include neurotransmission in the hippocampus, but also in other areas of the brain. This is in part why we see from this really cool schematic, which depicts the Montreal Cognitive Assessment Evaluation. And this is what's been used in some sort of pre-post evaluations of Huperzine A, the ability to, or at least potentially, the ability to favorably impact orientation, short-term memory, and then a cluster of things probably more relevant to those watching or listening to this: executive function, language ability, abstraction, and attention. And if you're trying to either be witty at a party, let's say, or make good decisions, then abstraction, attention, executive function, these are really important facets. And this is what the Montreal Cognitive Assessment evaluates. And it's been used as a pre-post measure in some of the research using Huperzine A. We also see an increase in miracle grow for the brain, aka brain-derived neurotrophic factor. And we've discussed in the past how things like exercise and sauna can increase BDNF, brain-derived neurotrophic factor. And as you can probably infer from the name, this will literally lead to growth and or better connectivity within the brain. So we have increased acetylcholine in terms of one mechanism, increased brain-derived neurotrophic factor as another mechanism. And then also interesting and very important is reduced inflammation. There's actually a reduction in microglial activation, which are immune cells in the brain. And when there is too much inflammation in the brain, this can correlate with things like brain fog or with cognitive impairment. As we come to the protocol, we want to be thinking about the pharmacokinetics and really the half-life, because this is what I learned the hard way we should factor into our dosing frequency. The half-life is 12 hours. Now, comparing that to other compounds, nicotine is 2 hours, and which, by the way, has some really nice neuroprotective effects when we take it out of the baby bathwater argument of vapes or cigarettes. So that's important. That's another topic. We've done a podcast on that in the past. Caffeine's half-life is 3 to 7 hours. So this is a long half-life, and it may take perhaps as long as 20 to 28 hours to fully remove Huperzine A from the body. It's not a bad thing, but it just tells us that if we're dosing every day, the chance that we're going to have a accrual of too much acetylcholine will be a viable risk. So because of that, enter the protocol that is sort of a derivative of my research, my experimentation, and what's been used in the trials, and what I personally do 200 to 400 micrograms every other day to every 3 days, and then stop and have a gestation week every 2 to 4 weeks. As you can see here, collagen shows benefits to the skin, and these benefits are fairly well established, including human trials showing an anti-aging effect, improving skin elasticity and moisture in 3 different trials. There's also evidence showing that collagen gives your joints and muscles support. There have been a randomized control trial for both osteoarthritis and another for just generalized joint pain, both showing improvement in the joint pain and function. And remember, randomized control trials are one of the highest levels of scientific evidence. And also a human interventional trial showing benefits for muscle strength. And continuing here regarding gut health, there is preliminary data. It is animal data, so we have to be a little bit cautious with how much we extract from this, but we can infer from these results that collagen is beneficial for the gut. Are you getting enough collagen in your diet? Now, the main source of collagen in the diet can really be found in bone broth or from bone broth and or from gelatin. So if you're making a lot of soups that will essentially kind of cook out from the bone and connective tissue collagen and gelatin, then you're probably getting a good amount of collagen in your diet. But if you're like most people, you may not be eating enough of these foods, and this is where a simple collagen supplement can really help fill in that gap where you're not getting quite enough in dietarily. So again, consider adding collagen to your supplement protocol to help improve gut health, skin health, joint health, and muscle health. If this resonates, then I'm very curious to hear in the comments section how the protocol goes for you. In the close, I want to leave you with a quote from Dante. The secret of getting things done is to act. So keep experimenting with your health. Don't give up. Keep trying. Keep making changes. And before you know it, you'll be feeling much better. Alrighty, this is Dr. Ruscio. Talk to you next time.